Hi, I'm Katie Stevenson. I'm one of our rural training track residents, and I'm here with Dr. Linsey Monaghan. Linsey, can you tell us a little bit about yourself? Who are you? What do you do here?
Yeah, thanks, Katie. Glad to be here with you today. And really glad to be here talking about our rural training program in Port Angeles. I'm one of our faculty members, and I also do a lot of other stuff at our clinic and in our community. I lead our addiction medicine treatment program and also host the Addiction Medicine Fellows from Swedish who come out for a rural rotation with us here in Port Angeles during their fellowship time. I also am the medical director at our county jail and enjoy hosting and teaching the residents in that setting. And I also have a special clinic that's low barrier for pregnant people who are experiencing substance use disorders. And in addition to my role as faculty for the rural program.
So you just wear a couple of hats. Just a few.
Yeah.
Sounds like you have done a lot of things with the program. Can you tell us about any specifically favorite memories you've had either with patients or with residents as part of the residency?
Yeah, that's a great question. I think this is a fantastic training setting for residents, especially who want to end up practicing in a rural area. We hit this sweet spot of having a large enough hospital to have the volumes to learn. We do have specialists in town to learn from, but there's a lot of specialists we don't have and aren't always available to us in the hospital. So this leads to some pretty awesome ways for the residents to grow their learning opportunities and stretch themselves. One story that comes to mind was with Dr. Poole, one of our early residents in the program. She and I were taking care of the hospital service over the weekend. So that weekend, we had a patient with a defibrillator who was now on hospice care and likely was going to pass sometime over the weekend. And we didn't want that defibrillator going off during this important time of his passing. Unfortunately, we do not have inpatient cardiology available at our hospital, and we really needed this device turned off in a time-sensitive manner. And so Dr. Poole and Dr. Poole led the charge on this. She contacted the device representative, and over the phone, they walked us through deactivating the defibrillator, and we were able to do that for that patient who had his family nearby and was able to have a peaceful passing. But that's kind of an example of the kind of things that residents can do here in a rural setting that helps set them up for future practice.
Since you do work with at a residency and with residents, are there things you particularly enjoy about working with all of us or that you've learned from residents that you'd want to share?
Absolutely. That's a big part of what brings joy to my career and my life. I really love learning from the residents, right? Teaching is fun, but you guys teach us just as much as we teach you, and it's a really good mutual relationship. You guys help keep us up to date on the latest teachings from your training in the urban areas and recently coming from medical school. And you guys really push us in our anti-racism work, in LGBTQIA plus learning and care. And I really like that we bring that to a rural space. I think sometimes there's this mythology of that's an urban thing, which it's a people thing, right? And I really love that we bring that to a rural environment. And I appreciate having your all's enthusiasm for learning and caring for patients is really infectious and really keeps us going. And you guys are just really fun people.
I agree.
Yeah.
I think we are.
I think we have a good time together.
Are there any specific things that the residency does to support sort of bonding between faculty and residents or resident time?
Yes, these are some of our favorite times of the year. We love talking about our annual river trip. This is in July. We get together with the interns, the R2s, R3s, the faculty, and we float down the Hoh River, which is west of here. It is just beautiful. It's an amazing bonding experience of working together to keep the boats going and be safe. And then we camp that night, and another great experience of cooking together, planning the meals together, singing around the fire, telling ridiculous stories. It's always definitely a highlight of the year. The other thing we really like is 4 times a year, our didactics are what we call site-specific didactics, where we divvy up by our clinic site. And for us, of course, it's the Port Angeles folks. We meet up in Kingston, which is a halfway point between Seattle and Port Angeles, so that we can spend time with our interns who are spending their year in Seattle. And we really appreciate have that time getting to know them, connecting them to our program where they'll be for their 2nd and 3rd years. And that's just always been a really important time for us, and we're going to keep that going.
When you're not doing things with the residency or for work, what else do you like to do in Port Angeles? What are the other things to do here?
Yeah, we love living here. It's paradise. We've got 2 kids, and we love being outdoors, love kayaking and camping and hiking. Sometimes just going and being down by the river and letting the kids play in the water. And yeah, there's no shortage of things to do outdoors here, whether you want to be on the coast or in the mountains or in the woods or at the lake. It's all right there. I love growing my own fruit. I've got strawberries, raspberries, blackberries, and blueberries.
You didn't tell me any of that.
I know.
You're hiding them from me.
And now I'm into canning.
Oh,
very exciting.
Oh my gosh. I'll have to have a jam session.
Exactly.
With fruit.
Right? And you know what? I love food. I love cooking and baking with local ingredients, which there's a plethora of around here.
You recommended a CSA that we're using. That's really
Oh,
great.
good. Yeah, perfect. And there's, for a small town, really have some great restaurants and wonderful places to eat. So we're pretty lucky.
Yeah.